Hello, I'm Dr. Shoshana Garfield, and I'm here to talk to you today with some secrets about depression that most medical doctors don't even know to tell you about, which are very important for handling either yours or passing on to friends and family to help them recover from their depression. And there's a summary, Coping with Trauma, Hope Through Understanding, John Allen, a fantastic book and a really compassionate chapter on depression in there, highly recommended. The secrets about depression. Okay. So the first super important thing to know about depression is that depression is not depression. Depression's a mask for other feelings, mainly overwhelmed with stress and anger that hasn't been expressed or processed. And so ultimately, depression is overwhelm, stress, and anger. That's it. And the second thing about stress that's really important to know, because they feed into each other, is that depression is this kind of self-perpetuating system, that the more depressed you are, or the more depressed someone else is, the more hard it is to get help, the more hard it is to keep promises to intervene, the harder it is to just poke one's head above water and just even ask for help. And so between the overwhelm causes a downturn, the downturn causes more overwhelm, and it's just this great big negative cycle with more and more depression in it and more incapacitation. Kind of sucks, huh? And there's things that you can do about it. Of course, there's always things you can do about it, right? So, some things you can do about it. Number one is recognize. Recognize that this is your thinking, or the thinking of someone, of a friend or a family, that our natural state is one of immense joy and peace and calm and even wisdom. So depression is some kind of overlay. It's an error, an illusion of thinking. There is no depressive feeling without some kind of down thought attached to it, however, out of the range of consciousness, in the unconscious. So to recognize that it's just thinking, take some distance. I'm not depressed. I just think I am, or I've thunk myself into this hole. It's not real. Just talked myself into it. Don't. And then you can be a bit lighthearted with it. And the lightheartedness itself, just lift things a bit. Of course, when you lift things a bit, then you have room to do other interventions too, such as exercise. Did you know that, like, taking Prozac or Zoloft or any one of those other things, it's like putting on glasses to correct your eyesight. It doesn't correct your eyesight. It makes it possible to read in a moment. But you take the glasses off, yeah, you're right back to where you were. So those things don't cure depression. But what can cure depression, even prevent it in the first place, is something very simple. That's exercise. Exercise releases endorphins. It has the added effect of making you healthier. And being healthier makes you feel better in your body. You feel better in your body, you feel better about you. Exercise. So get a bit of distance, and then do a little bit of walking, some very simple exercise, or get a little trampette and do some bouncing in your home. Whatever it is for you, whatever's going to be fun, do something fun. And so those are two things you can do. A third thing you can do, of course, is one of my very favorite things, and that's emotional freedom technique with tapping. I know it looks wonky. I know it can even look stupid if you don't know what it is. There are lots of videos about what it is and how to do it. Do it. It works. And if someone is too depressed to motivate themselves to do it, then maybe help them organize it, or tell someone else, look, help me organize this because I'm too depressed to manage it. And help them stick to it. As many of you know, I have a clinical load. And one of the themes of the past week has been kicking the butt of really getting people to really do the stuff that they know is good for them, but they've been blocked in doing because they've been too depressed. They've been too caught up in the seriousness of their thinking to do what they know is right. And so to really help the people that are in your life, or help yourself, having someone give you a very loving and compassionate kick in the butt to change your thinking and start doing the things you need to do, which may also include getting John Allen's book. So on that rather cheerful note of a call for action, very, very best wishes for a really wonderful week. Bye for now.